tuning in. My name is Julie Schubach, and I'm the director of the Senior Resource Center at Family Service. CUI's TV is a collaboration between the local aging network, Parkland College TV, Urbana Public TV, and the wider community to produce and air engaging local content designed specifically for older adults in Champaign County. CUI's TV is a project of the Senior Task Force, an interdisciplinary group of professionals and community members that meet monthly to discuss and take action on issues affecting older adults in Champaign County.
Hi, I'm Kathy Rhodes from Circle of Friends Adult Day Center, and during this time of COVID-19, our center has been closed. We've been doing things like activity packets and phone calls, and then using technology such as Zoom to do our activities online. But we have found that the older population, including myself, are not that tech savvy. So we decided that perhaps using a venue that we're more comfortable with, such as a TV, would be a good option. So we decided to do a TV station just for senior activities. I hope you enjoy.
Hi, I am Michelle Roberts. I am the program director for the Occupational Therapy Assistant Program at Parkland College. The goal of CUI's TV is to provide opportunities for local older adults to move their bodies, to exercise their brains, and offer entertainment and engage with the community from the comforts of their own home. Whether they are sheltering at home in the midst of a pandemic or simply not getting out into the community as much as they used to. This is a wonderful opportunity to engage and participate in various programming. I hope you enjoy.
Hi, I'm Liz Sollard from Synergy Home Care, and we are so excited to bring you content tailored specifically for you. We will have exciting entertainment such as comedians, musicians, and a nostalgic cooking show. We will have exercises and stretches you can do right from home, and we will also have senior-specific education, health tips, and more. Stay tuned.
Hi, I'm Laura Rice, the Senior Outreach Coordinator at the Champaign Public Library. We hope that CUI's TV will be an ongoing community resource that you can tune into each week. CUI's TV is available Tuesdays at 11 a.m. on Parkland College Television or Thursdays at 1 p.m. on Urbana Public Television. Both are available to stream after the program airs on youtube.com. If you have any questions or suggestions for content you'd like to see on TV, please email us at cuistv@gmail.com. That's the letter cuistv@gmail.com. Thank you.
So today we're going to be talking about back pain and kind of all aspects of the back. So we're going to talk about some anatomy, and then talk about some of the way that therapy can help you if you are suffering from some back pain. So the back. The back is made up of strong bones, as we can see here in this picture. A lot of bones and muscles connected to our spine. So our spine starts from right at the base of our skull and then goes all the way down to our tailbone. So the back is made up of bones, ligaments, tendons, muscles, and some highly sensitive nerves. That way, if you do have back pain, it's definitely going to tell you that it's there. It's designed to be incredibly strong. So our midsection there from our neck to our hips, that's what holds us up. So in any activity that you do throughout the day, that's what's holding us up and helping us keep going. It's highly flexible, and it helps us provide in different planes. So we're able to flex, kind of bend and twist. Most of us take this strength and structure and flexibility for granted in our everyday lives because everything we do uses our back, from getting out of bed to using the restroom to taking a bath to sitting at the dinner table, until something goes wrong. So we'll be talking about how to manage when those things go wrong. Once we have back pain, we are driven to figure out why. Whether it's some neck pain, whether it's kind of your middle of your back, or maybe lower back that's sending some signals down to your leg. So how the spine may produce back pain. There are many different structures in the spine that can cause back pain. So one of the first ones there is that large nerve root. So in our spine, we have a spinal cord going all the way down the middle, and then it branches out into different spinal cords, which make those nerves. So if anything is being compressed, you may have some pain from that. Some of those smaller nerves that innervate from the spine to maybe our extremities, very common shoulder pain. Some of that shoulder pain can be stemming from your neck, but be pinched somewhere in the shoulder. And then the large paired back muscles, the erector spinae in your back. So a lot of spinal nerves coming out in your back and a lot of big muscles there. So the bone and ligaments or joints themselves are injured, or the disc space. So we'll talk about that in a following up slide. Therefore, the review of spinal anatomy is very important to understand where your back pain is coming from. So here, we're looking at the different parts of your spine. So at the very top, those cervical spine, which I said it kind of start at the base of your skull to about your clavicle. And then thoracic. The important part of the thoracic spine is that they come from just below your clavicle to about the bottom of your rib cage. Those are the strongest parts of your spine because they're connected to ribs. So it kind of makes a cage to protect all of those organs inside. The lumbar, as you can see, they start to get a little bigger, are also considered a very strong part of your spine because that's where our flexibility is. And there are no ribs attached to those. So that has to stand alone and be strong for all of our bending and twisting and flexibility. And then we come down to the sacrum, which is this one here at the bottom. And that is kind of a triangle shaped in between your two hip bones that allows that lower body to move around. And it also has spinal cords coming out from it. And then at the very bottom of that sacrum is our coccyx, which is also known as a tailbone. So if we have fallen at any point in our lives, we know that that is very tender when we fall on that area. All right. So specific risk factors for back pain. We'll start with number one. Unfortunately, aging is one of them. So over time, wear and tear of the spine that may result in these different conditions as disc degeneration, spinal stenosis, or anything that can produce neck and back pain. Unfortunately, we're all aging. From the time that we're born, we are all aging. So that means that people over the age of 30 or 40 are at more risk for back pain than younger individuals. So I think most of us in this room, maybe except for one, are over the age of 30. So maybe as we age, even though we're not in our young 20s anymore, maybe that age group of 30 to 40, they think, or we think, we can still do some of those things that we did maybe in our teen years or our 20s. So it slowly starts to catch up with us, and we'll talk about why when we look at our discs. And then it says people age 30 to 60 are more likely to have disc-related disorders. And again, we'll go into maybe a little into that as to why. People over the age of 60 are more likely to have pain due to osteoarthritis. So, any idea what the osteoarthritis is? So that's when our bones are starting to become a little brittle, and we'll need some extra, maybe vitamins to help keep them stronger. All right, number two, genetics. there's not much we can do about genetics, so if it is in your genetic makeup that you may have some degenerative disc disease, we can work with therapy to make sure that the rest of your body is strong enough to avoid the progression of the degenerative disc. And then number 3, a sedentary lifestyle. So we can see our little miss here hanging out on the couch. Couple things. In a couch that's not very supportive, there's no back, this armrest is very thin. And then what about her posture? She is slouched, no lumbar support, no head support, and her knees are bent, which may be a comfy place to watch a movie, but we're not supporting our spine. And then excessive weight. Being overweight could put more impact on our other joints, so our hips and our knees. So when those joints begin to have pain, then we compensate with our trunk, so our lumbar and thoracic spine. Poor posture. I think everybody could work on posture, no matter what age we are. So pulling those shoulders back, pulling those hips forward. We can look at how we're sitting in our chairs today, or if we're standing with a slunched over posture. Everybody can work on posture. And then smoking. People who smoke are more likely to have back pain. So don't smoke. All right, so here we can talk about some disc degeneration. Discs are actually composed of 2 parts, a hard part and a soft part. So it's kind of like a jelly donut, if you want to get that image in your mind. So we got the donut on the outside with that jelly on the inside. Over time, spinal discs dehydrate, so that inner softer part starts to dehydrate, causing them to become stiffer and causing the disc to be less able to adjust to the compression. So over here on our picture, we're looking at a normal disc, which just fits nicely there in between the 2 vertebrae. And then the second one here is a degenerated disc. It may be a little hard to see, but there's a little tear right here in that disc. So if the tear on the outside of our donut, we took a bite, where's that jelly going? It's ready to come out. And then we have the third one here, a bulging disc. So inside here, this disc is bulging, and this is kind of where the spinal cord travels through. So we're putting this bulging disc here is putting pressure on that spinal cord that's then telling wherever that spinal cord goes to that you're having pain. And then we have a herniated disc. So that jelly of that donut is all the way out. And it's putting more pressure on the spine and telling you that you're having more pain in that area. And then we have a thinning disc. So as you can see up here in our normal disc, there's quite a bit of space in between the 2 vertebrae. And then down here in our thinning disc, it's very thin. So not a lot of cushion in between there to allow movement. And then down here at the bottom, we have disc degeneration with osteocyte formation. So up here, our vertebrae are pretty smooth. Down here we have some jagged edges, so some ridges. So when they are compressing on that disc, there's some jagged edges that are rubbing against each other. So every time it does that, it's telling those nerves that it hurts. Let's go to the next one. So some neck pain could be caused from our spine. So like we said, that cervical starts right underneath the base of your skull. So some acute neck pain is most often caused by a muscle or ligament or tendon strain. So sometimes if you sleep wrong, you'll wake up and you'll say, "Oh, my neck is sore." More than likely that will go away within a couple days, and we hope it does. And then it will usually heal within time, and no surgical treatments or anything like that are needed. We can use a little bit of ice or heat to calm it down. And we are going to do a do-it-yourself ice pack and hot pack at the end. So if you're suffering from some neck pain, we'll send you home with something to help that. For individuals with neck pain that lasts longer than 2 weeks, with maybe some pain down the arm due to the area where those nerves follow up to, some numbness or tingling, there is often a specific anatomic problem. So that's where it would take someone to kind of look into what's going on in that part of your neck. For example, pain that radiates down the arm and possibly into the hands and fingers is usually caused by a cervical herniated disc or for foraminal stenosis pinching the nerve in your neck. All right, how about some lower back pain? If we're not having it up here, maybe you're having a little bit lower back pain. The vast majority of episodes of lower back pain are caused by muscle strain. So even though the muscle strain doesn't sound like a serious injury, trauma to that muscle or other soft tissues or ligaments or tendons in the lower back can cause severe back pain. And like we said earlier, that middle section is standing alone with just those vertebrae and all the muscles around it. So it's working really hard. The good news is that soft tissue does have blood supply. So you know how we were talking about the different discs in the spine? They are made of the hard and the inside soft. There's no blood coming to those discs. But our muscles and our tissues, they do have blood supply. So therefore, if they're injured, they can heal themselves a little bit by having more red blood cells. So it will help with that healing process. Now it may take some time and your back may not feel like those blood cells are getting there fast enough, but maybe with some intervention, we could help that process along. So low back pain and motion. 50% of flexion, so bending forward, occurs at the hip, and 50% occurs at that lower spine. So we're using our hips and our spine to lean forward. The motion is divided between the 5 motion segments of the lower back, although disappropriated amount of the motion is at L3 and L4. So when we're talking about our spine, that lumbar spine, which is about here, so we're talking about L3, L4, where that bend starts to happen, is where some of that pain tends to come from. Consequently, these 2 segments of the lower back are most likely to break down with degeneration as they become unstable, the excess of motion causing that low back pain. So that may be if you're walking around like this, then you're really straining that lower back a lot of the time. So that's where posture comes in. So if we can tuck that lumbar section in just a little bit, it will help straighten up our lower back. All right, so here are some vertebral compression fractures and back pain. So that flexion motion that I was just showing you puts pressure here, but it also causes your upper thoracic and cervical to lean forward. So the vertebral disc in the spine is intersecting in unique structure. Its primary purpose is to act as a shock absorber between adjacent vertebrae. There are a total of 23 vertebral discs in the spine, so from the top to the bottom. Since there are major load-bearing structures, vertebral bodies are also prone to developing compression fractures, particularly in patients with osteoporosis, which weakens the bone. So people that have osteoporosis may be making some of these movements and no injury has happened, but they could have a compression fracture along the way. So this motion here with this lateral flexion to the right is a very common way for people to have a compression fracture, because this part of your spine here is compressing against each other. And if we have osteoporosis, then those are just weak vertebrae that may have a fracture in that movement. So this hyperextension is if you're really pushing your hips forward and your head back. So one, walking like this is kind of difficult. Two, it could throw your body off balance, putting you at risk of a fall, but it's also putting a lot of extra pressure there on that lower back. This lateral flexion, so sometimes I see this if you're walking with a cane and you're putting a lot of pressure on that cane, then you're walking and leaning all on that side. So there's different reasons of why you may move in these positions. And then this one here is showing the rotation of kind of that cervical thoracic area when you are either looking forward and kind of turn. So you're putting a lot of pressure on your cervical and thoracic area. All right. These fractures, so here's a picture of a compression fracture here. So it happens in the big part of the vertebrae. And as you can see, there's some redness there because what's happening when we injure ourselves, the blood cells are coming to that area to try to heal it. So these fractures can lead to chronic back pain, progressive, malignant, or deformity of the spine. So as we when we fracture the spine, there's not really a cast that can go on our cervical thoracic or lumbar spine because it's inside of our body. So the only way to make sure that we're not bending or moving them too much is to put on a brace. And they can be cumbersome and uncomfortable, but putting on that brace will kind of not keep us from moving, but remind us not to move as much. So over time, the malignant or deformity of the spine places stress on other muscles. So if you have a compression fracture and you bend and it hurts, then you're trying to use your other muscles to help you stay steady. And it could be that you're compensating with those other muscles that could cause other problems. And then also important, back compression fractures, the back pain from that can impair your balance and walking ability. All right, so here are some different types of back pain. So the acute back pain comes from suddenly and usually lasts a few days to a few weeks. So painful, we need to address it quickly with either some ice or some heat, and then see if it will go away with some rest. Chronic back pain, typically described as lasting for more than 3 months. So that has been bothering you for a long time. Every time you move in a certain direction, every time you complete a certain task. And if it's ongoing, then there's something going on in our body and we haven't been able to get rid of that pain. Back pain can take on a wide variety of characteristics. Here are some of the words that you might be using when it talks about pain. Is it a burning pain? Does it ache? Is it bothering you? Is it a dull pain? Is it a sharp pain? Do you feel it during the day compared to the night? So when you're working with your therapist or telling your doctor about the pain that you're having, then using some of the words to describe your pain will be able to help us and guide you as to how to help you. All right, so here are some back pain characteristics. The pain may be consistent, intermittent, or only occur with certain positions and activities. The pain may remain in one spot, or it can radiate to other areas. So in some of the patients that I've worked with, when we talk about maybe their arm hurting, maybe their elbow is causing them some pain or their shoulder is, I always know to kind of come back to that cervical spine and see what's going on here to see if I can fix their arm. It may be dull, ache, or sharp, or piercing, or even give you a burning sensation. So everybody's leg has probably fallen asleep at some point. So that sensation of it feeling kind of asleep or burning, the pain could be causing that because of a compression of your nerve. The problem may be in your neck or your lower back and can radiate. I'm sure some of you have heard the word sciatica. So that comes kind of from your pelvic, your buttocks area, and it's compressing here, but it affects your leg. And you're wondering why your leg hurts, but really it's that spinal area. Other back pain or back pain symptoms may include some weakness, numbness, or tingling. So if you're having any of those symptoms, make sure that you explain to your doctor, your provider, where you're having them, and then explain with some of those descriptor words. And it may change. It may start sharp, and then as we work with you, or as everything heals, it may turn into more of a dull pain. Pain with certain movements and positions, such as bending forward or running, the pain tends to fluctuate with a lower level or no pain at times, and could flare up at other times. Has anybody ever been able to tell when a storm is coming? Yeah? Okay. So sometimes if a storm is coming, you may feel some of that arthritis pain. You may have some arthritis of your spine and feel that as well. Lower back pain can often accompanied by leg pain, which worsens when standing or walking for a long period. So when we think back about our spine and our cervical disc, pressure on each vertebrae, and let's say we're standing for a long time or walking for a long time, all that standing or all that walking puts more pressure on those discs that may already not feel so great. So here at our picture, if you can see these little yellow parts that are coming off of the bone, those are our nerves. So the spinal cord is way back there in the back, and these little yellow parts are nerves that come out from our spine. So this is a nerve entrapment associated with a degenerative spondylolisthesis. So it is kind of moving side to side with these arrows when you walk, and that disc already has some degenerative aspects of it, causing even more pain. Lower back pain that is worse in the morning and in the evening and stiff, usually in older adults. This back pain can be caused by degenerative arthritis. Pain that is felt down the legs when walking or standing upright, and that feels worse with more walking, gets better after sitting down, usually in older adults. This pain may be caused by lumbar stenosis or the degenerative spondylolisthesis. So we'll look here at our pictures. This is if our spinal cord were cut, this was what we would look in. So this in here is the spinal cord, and these are the nerves coming out of the spinal cord. So any compression in here could cause that spinal cord to start being inflamed, then following up with the nerves that are coming off of our spine. This one here, so this is looking at someone's spine from this direction. So we see our different vertebrae here with our disc that is normal and our disc that might be degenerative on top of the inflammation inside the spinal cord here could cause spinal stenosis. So a lot of compression. When we compress on nerves, they're not happy. So we could work in therapy to kind of help strengthen the areas around. So if this is your thoracic area and this is more your hips and lumbar sacral area, we can strengthen these areas to relieve some pressure in the middle. This is also a same view from here to here. So when that nerve here is inflamed, it's pushing on all of these areas and that bulging disc. So kind of showing you two viewpoints of what's going on there with that spinal cord. All right, when to see a doctor for your back pain. In general, if the pain has any of the following characteristics, it is a good idea to see a physician for an evaluation. So back pain that follows an accident or a fall, we definitely want you to see the doctor as soon as possible because there could be an acute fracture or an acute injury that they can help you with. Back pain is ongoing or getting worse. So it may have started uncomfortable, you just can't get through your day, and then it progresses to unable to get out of bed or unable to walk down the hallway. So we'd want you to see the doctor then. If the pain continues for more than 4 to 6 weeks, so no longer is it acute, it's more chronic, so we want you to see the doctor to see if there's any interventions. And if the pain is severe and does not improve after a few days of typical remedies, such as rest, ice, and maybe some common pain relievers like ibuprofen and Tylenol. Some other ways or reasons to see a doctor are if the pain is so severe that it wakes you up at night. We need to get our rest. If the numbness or altered feelings in the upper inner thighs, your groin area, buttocks, or your genital area. So any numbness there, we would need to see a doctor. Neurological symptoms such as weakness, numbness, or tingling in the extremities. So in your arms, foot, leg, toes, hand. Or if it's accompanied with an unexplained fever with increasing back pain, then there may be something else going on with your system. Or any sudden back pain, especially if you're at risk for osteoporosis. So that osteoporosis is where we talked, maybe just moving could cause a compression fracture. We would want you to see your doctor. And here are some therapy interventions. So as your rehab director here in the facility, our team would be able to help you in any way with some of these. There's a wide variety of therapeutic options for back and pain treatment. Some of the most common are modalities. So that would consist of heat or ice, ultrasound, e-stim, or iontophoresis. So you may not know what some of those are, but ultrasound is kind of a wand that will go over your body and produce some heat to help decrease the inflammation inside to those joints and muscles. E-stim, we have some sticky electrodes that we were able to put on your body, and it does have an electrical current, but it's a comfortable electrical current to kind of wake up those nerves, stimulate those muscles again to help them calm down. And then iontophoresis is a medication that combines with the ultrasound. So we put that medication on your skin, we do some ultrasound, and it penetrates through your skin to reduce some inflammation. Another way that therapy can help is by manual manipulation. So that's kind of what this picture is showing here, a therapist that is manipulating those muscles around the spine. So it could help relieve pain from your neck all the way down. And like I said, if I had a patient who had some pain here, I would manipulate back up to the cervical area to see where they're tight. And massage, so the manual manipulation, will also improve blood flow. And what helps us heal our injured parts of our body? Blood flow. So A massage is always good. So going to massage therapy can also help to improve that blood flow, reduce muscle stiffness. Just be cognizant if you're seeing a massage therapist that they know of your other possible injuries that you might have. So they may just need to know a little bit more. Therapeutic exercise. So we see they're using a TheraBand here in this picture. Once you decrease that inflammation from that muscle, we need to strengthen it again. So with doing so, we can hopefully prevent injury in the future. And they say low impact aerobic exercise. So once something is already inflamed, if we move real fast, we're just going to irritate it and inflame it again. And then aquatics. So we here at Clark Lindsey have an aqua pool, and we're able to provide therapy in there as well. And we have a good arrangement of aqua courses already that can help you kind of move your joints in a soft, easy way to allow them to move with less resistance and use the buoyancy of the water. And then we also have some benches in there, if you haven't been in there yet, where you can just sit and relax. Let those muscles warm up a little bit with the water temperature. And some other therapeutic interventions are some different things that you can use to get through your day. So we call these things to help you get through your activities of daily living. So anything that you would do for yourself throughout the day. This first picture here is a raised toilet seat. So it adds maybe 3 to 5 inches, depending on how much you need, to the height of your toilet. And then it has some rails to help you get up from there. And if we think about why would we need a raised toilet seat, well, maybe getting all the way down to the toilet is putting too much stress on your back. So if we were to raise that a little bit, it would be easier to get up and down. This middle picture here is a reacher. It has kind of a trigger on this side, and then down at the end, it's got a pincher. So if you drop something, instead of bending all the way down, you would just use a reacher to kind of save on some bending. And then here on the right, we have a shower bench or a shower chair. So we would use that to sit in the shower. So earlier I spoke that your back may cause you pain when you're standing for a long time. So if standing causes you some pain, you could sit in the shower, save some energy, and decrease some of your pain. Some other adaptive equipment is a long-handled sponge, and these come in a variety of different looks. So the concept here is a nice long handle, so you can reach your back, you can reach your legs without having to bend and twist too much. This middle picture is a sock aid. This is kind of harder to explain, but you would put a sock here at the end, and these ropes that are connected to it would then be able to put your sock on without bending. And then this other picture here to the right, this is called a long-handled shoehorn. So most of you know what a shoehorn looks like, and they're usually, maybe about this size? But this would have a nice long handle so you could reach down to your foot without bending. Some other therapy interventions is work, simplification, and modifications. So as an occupational therapist, and I am one as well, we can help you explore how to do some things differently to simplify the work that you have to do throughout the day. So here she is looking at a catalog, a book. So she has it in her lap. Her neck is flexed forward, and her back isn't against the seat, and her legs are crossed. All right, anybody got their legs crossed right now? Uncross those legs, you'll feel it in your lower back. So over here is the right way to sit. So feet flat on the floor, back against the chair, and it kind of looks like they put a cushion in there. So you may use a pillow or a cushion to put on your back. Her head is straighter, even though she's still looking forward, but she has a little table there that she's sitting at. All right, down here at the bottom, she's tying her shoes. As you can see, her back is bent all the way forward, even her neck, to reach down and tie her shoes while she's sitting. So an alternative to that would be to put your foot on a resting stool or use another chair, maybe somewhere in the bathroom that you can prop your foot up, and you can see that her spine is not stressed as much as before. So there's always ways to simplify the tasks that you're doing, and as an occupational therapist, we can help you with that. So in conclusion, back pain can greatly impact the quality of an individual's life. And from a therapy perspective, we want to help you be able to complete as many of the tasks for yourself throughout the day. So any way that we can help, even if you're not in a lot of pain, but even if you're just struggling and it's causing you a little bit of pain, we can always help with that. Both acute and chronic pain can be addressed. So if it's, I just hurt my back because I twisted the wrong way or I slept wrong, we can get in there quickly, get some modalities on you and help. Or if it's chronic and you've been living with it for a long time, we can help there as well. Rehab services can help to identify the cause of the back pain and develop a comprehensive program to best manage your pain. So a lot of those interventions that we just went over, some of those pictures, we may guide you to use some of those things to decrease your back pain. And of course, at any time that you feel that you might need some help with any of that, reach out to myself or the therapy department, and we can help you with that here at Clark Lindsey. So that concludes the presentation. All right, stay tuned. We're going to make some DIY ice packs and DIY hot packs for you to take with you today, okay? All right. To start off, we are going to make a hot pack that will look like this in the end. This is just a sock, and it's filled with rice. So you may have heard of that as a DIY that you can do at home. So we'll show you how to make one here. All right, Rachel, my assistant, will help us fill this sock up with some rice. And just regular long grain rice will work. And you can use any size sock. Sometimes the long tube socks for a bigger area will help. So we'll use these for maybe just a small area, maybe your neck, shoulder, and we're just going to tie that off with a string. We don't want to lose any rice. Now, once this is tied off, you should be able to keep all that rice in there together. So how to use this? If you want to hand out to those here, you can hand it out to them so they can feel it. So very pliable, you can move it around. What I would suggest is that you use a little bit of water to dampen the outside of the sock, and then microwave it for maybe about 30 seconds. It may need a little bit more after that, but once it's nice and warm, then you can use it. Maybe if your neck is hurting, maybe if your elbow is hurting, you could use it on your back. I would suggest maybe a little bit bigger sock if you're going to use it on bigger body parts. All right, so there are our DIY hot packs. And remember to microwave them just at short periods of time. So now we're going to make a DIY ice pack. So we'll move these aside. And we're gonna start with a freezer bag. So Ziploc freezer bag. We're gonna make, these are quart size bags, but you can make freezer bags or like a gallon, whatever works for you. So the way that we make these is we use 1 part alcohol. So just a rubbing alcohol solution. So for instance, for this quart bag, I'm using 1/2 cup of alcohol and 1 cup of water. There we go. And then I'm just gonna grab 2 cups of water, mix it in here. All right. So, do we have the, so then you could add food coloring if you want to make it colorful. So then we would just make sure that our bag is closed, and then you can pop this in the freezer. So because we mixed alcohol with the water, it will not freeze all the way. And Rachel, my assistant, just ran to go grab the frozen one. We didn't want to pull it out too early because then it would look liquid like this one. So there's the one that needs to go in the freezer. And here's the one that came out of the freezer. So still kind of like a gel, still moves around a little bit so it can work around a muscle or a body part, but very cold. So this one did melt a little bit in transit, but once you put it in your freezer, it will kind of get slushy. So there are 2 ways to help relieve your back pain today.
Thank you for tuning in. We hope you enjoyed the show. This video can be accessed anytime on youtube.com. Type in Parkland College TV in the YouTube search bar and subscribe. We hope you will join us again next week for more local engaging content designed specifically for Champaign County older adults. Take care and stay safe.